the conference must go on, and we begin our session. I'm Yuri Kistyunov from Tom State University, and I will be chairman for this session. It's a joint session about biophysics, macroscopy, and low coherence methods. Invited talk will be 20 minutes, oral talks 15 minutes. Dear contributors, please save time for discussion. And the first talk will be done by Dunaeva A.V. from Oral State University. The title of the talk is presented on our screen. Please, Andrei.
Thank you very much. Dear colleagues, good morning. First of all, I would like to say many thanks to organizers for invitation to make an invited talk. I would like to present you some results about using possibilities using wearable devices of multimodal optical diagnostics of microcirculatory tissue systems. I will show you some application experience in the clinic and during our space experiment. Just a little bit information about where we're from. Oral City is not so far from Saratov, and our city was born almost at the same time. This is our university, Oral State University. Now this is a flag named as a flagship university. This is most university in our region. And our research and development center trying to develop possibilities for more widely using optical non-invasive diagnostics in clinical practice. The main directions of research in medicine, you can see at this slide, includes area in endocrinology, functional diagnostics, and so on. Part of these examples in these areas I will show you in my talk. Outline. My talk includes some questions, we can see here, and applications experience in clinical practice, first of all in endocrinology area, and in yoga breathing exercises, and rehabilitation after COVID-19. And I will show you our results, obtained results from our space experiments. Just basic information about our methods which we used in our wearable devices. Our wearable devices include laser Doppler flowmetry technology. We can see here this technology based on optical probing by tissue, and after calculated index of microcirculation perfusion, and the main important in medicine, analyzed after registration of perfusion, analyzing microcirculatory rhythmic oscillation, endothelial, neurogenic, myogenic, respiratory, and pulse. And another technology in our devices is fluorescence spectroscopy. Again, very well-known technology, simple technology, and our approach, as we named this approach, multimodality approach, based on summarize results from LDF method and from fluorescence spectroscopy. And new diagnostic criteria we developed and we made oxidative metabolism index. This index allowed to us assess relationship between supply oxygenated blood in capillaries bed and oxidative biotissue metabolism, oxidative metabolism in biotissue. This is something like systematic view on microcirculatory tissue system. New trend in medicine now is wearable electronic diagnostic devices. It was, now we using this gadget, this device. Again, this device include a laser Doppler flowmetry, this modification only laser Doppler flowmetry, and another and over technology, optical non-invasive technology. This modification model we can register parameters blood perfusion, movements, and skin temperature. And this new modification, multimodality modification, wearable multimodal device, which include two these channels, LDF and fluorescence spectroscopy. Here we can see diagnostic volume and depth. Probing for laser Doppler flowmetry is about 1.5 millimeters, and this depth allows to us assessment blood flow by using this device. And the main goal of my talk is demonstrate the successful experience of using these new devices in clinical practice and in the conditions of space experiment. And in the next slides, I will show you some application experience in the clinical practice. Then our first example is from for endocrinology area for assessment microcirculatory disorders in patients with type 2 diabetes mellitus. We can see our protocol where was measurements machines. And our obtained results demonstrate that for group diabetes for patients group with diabetes mellitus, perfusion and nutritive blood flow, we can see here lower than for control group. Again, this demonstrated, this correlate with a problem in blood flow and, of course, event for metabolic processes of biotissue. This is a start for complication in diabetes mellitus. And again, non-invasive, fast, just 10 minutes. During our measurements, no functional tests, no temperature test, cold test, and so on, just baseline, and after we can see, we can obtain these results. Another example is for method of control, method for infusion therapy for endocrinology for type 2 diabetes mellitus. Perfusion control during intravenous infusions of alpha-lipoic acid solution in patients with diabetes. We can see again our protocol This is it's local place where our wearable device was on patients. If rule of measurements, total measurements was here, you can see, and again we obtained results which allow to us to see that after we can see here patients before therapy and after therapy, and this is level of perfusion for control group, and we can see that after therapy our perfusion have a tendency to level for the control group, and the same results for blood nutritive part. And a new example again for endocrinology. This is for pregnant patients with type 1 diabetes mellitus. This example for analysis of perfusion metabolic disorders in pregnant patients with gestational type 1. It was systematic measurement with laser Doppler flow meter fluorescence spectroscopy by using our wearable device and continuous glucose monitoring. We can see here, and our preliminary. This is a pilot study with our colleagues from St. Petersburg Institute, Otto Institute. We obtained results, and we can see a completely difference in myogenic range, oscillation between control group and diabetes mellitus group. And new example, very interesting results for yoga therapy or yoga breathing exercises for control of blood or microcirculation when performing yoga breathing techniques. We can see here full breathing modes, hyper and hyper breathing. You can see here index of microcirculation, and our preliminary results again demonstrate a difference for these two types of breathing, for hyper and for hyper. This is stage before, this is stage after, and we can see a difference only for hyper breathing for this type of breathing. Again, this is very useful information for yoga specialists, for doctors, and so on. And example is for rehabilitation after COVID coronavirus. And again, we obtained results with a difference between two groups, and perfusion is more for control group and for patients, difference for patients after COVID, more lower perfusion level. And this is results for one patient, but before and after acute of diseases of coronavirus. And we can see here some trend for amplitude oscillation, for breathing, for respiratory. And just a little bit information about our space experiment. And it was in December last year during International Space Station visiting expedition. And because the actuality was because we almost well known about functional system for human on the Earth. But what happens to microvessels in zero gravity, and what we know about adaptations, and how can this new information, and can we help people in the space. The aim of this work was a study of tissue respiration processes, oxygen utilization by tissue, and microcirculatory blood flow in human skin under weightless conditions. And it was, this is our protocol study. Our devices, I can show you, it was something like this device with two channels, multimodal wearable device. You can see a cosmonaut Mussorgsky Alexander, the place, it was per measurements in 4 hours, you can see here, and just a short, fast video from our space tourist Yusako Maezawa. We can see this experiment. Now Alexander Mussorgsky doing a measurement on fingers. Now, of course, now we see very fast, but our cosmonaut is a hero because almost 40 minutes during full these measurements one day. On ISS, there was 12 days. It was a short-term visiting expedition. And just a couple of results. It's our, of course, pilot study. This is perfusion for cosmonaut Mussorgsky. This is on the Earth before flight. This is on the in space, and after again on the Earth. And we can see very interesting results at this moment we analyzing. We can see 2-3 days, it was extremely adaptation in all of parts of the body in space. And these results for myogenic oscillation, again, very interesting, a difference reaction, like for example, for head and for waists and for toes, and for cardiac oscillations, and for nutritive blood flow. And this is results from fluorescence spectroscopy channel. This is amplitude of intensity fluorescence, and this is our complex parameters, oxidative metabolism index, and we can see again a difference reaction for example for head and for legs. And our main conclusion is for first times we obtained new data about state of microarticulation system of human body recorded with wearable multimodal device. And for us, it's very useful new information, and again, it's very faster and very interesting diagnostic information. This is our acknowledgements. This is our dream team, 11 members of our R&D center here, and we're happy to be here. And thank you very much for your attention.